Hi everybody, this is one of the videos of our lung cancer series. I'm Associate Professor Erkan Yıldırım. I'm a thoracic surgeon and transplant surgeon. And in the previous video we talked about epidemiology and symptoms, and in the very first video we talked about was lung cancer. Now I would like to talk about the signs and symptoms of lung cancer. So I have notes here, and I would like to read some times in order to not to miss the details, because such details sometimes mean so much for patients, and we don't know who gets benefit from these details. So if you have these symptoms, please let your doctors know about them. And if you first notice symptoms, your cancer might be diagnosed sometimes at an earlier stage, and earlier stages are a good chance for cure in any kind of cancer. Regarding lung cancer, these symptoms are more likely to be caused by something other than lung cancer. Just keep this in mind as well. Still, you have any of these problems, it's important to see your doctor right away, so the cause can be found and treated if needed. The most common symptoms of lung cancer are as follow: a cough, sometimes with blood, and if the cough doesn't go away in a few weeks' time and gets tougher day by day. Chest pain is due to the localization of the tumor. If it invades the chest wall or backside, then you might have really pain on that side, and most of the time regular painkillers don't work well for the pain relief. And hoarseness is that your sound gets rougher and sometimes painful, and loss of appetite, loss of weight, unpurposefully losing weight, and shortness of breath, feeling tired and weak. Infections such as bronchitis and pneumonia that don't go away or keep coming back, and new onset of wheezing, which means that narrowing of the bronchial tree, and your sound when comes out, and you can hear a sound like whistling. We call it wheezing. If lung cancer spreads to other part of your body, then the symptoms might change. Sometimes bone pain, like pain in the back or hips. Nervous system change, such as headache, a weakness or numbness of an arm or leg, dizziness, and balance problems, sometimes seizures, epileptic attacks from cancer spread to brain. And yellowing of the skin and eyes, we call it jaundice from cancer, which spread to the liver. Swelling of lymph nodes and collection of immune system cells, such as those in the neck or collarbone. Some lung cancers can cause symptoms which are groups of specific symptoms. And let's get into detail about these symptoms. The first one is the Horner syndrome. The cancers of the upper part of the lungs are sometimes called Pancoast tumors. These tumors are more likely to be non-small cell lung cancers rather than small cell. And Pancoast tumors can affect certain nerves to the eye and part of the face, causing a group of symptoms called Horner syndrome. Drooping or weakness of one eyelid, a smaller pupil, the dark part in the center of the eye gets smaller, and on the same side of the face, a little or no sweating on the same side of the face as well. Pancoast tumors can also sometimes cause severe shoulder pain. The other symptom, a specific symptom, is the superior vena cava syndrome. The superior vena cava, SVC, is a large vein that carries blood from head and arms down to the heart. It passes next to the upper part of the right lung and lymph nodes inside the chest, and it carries the blood to the heart. If this SVC, the superior vena cava vein, is compressed or blocked, then the patient's face, neck, and arms and upper chest swells, sometimes with a bluish red skin color, as well as trouble breathing. It can also cause headache, dizziness, and a change in consciousness if it affects the brain. While SVC syndrome can develop gradually over time, in some cases it can become life-threatening and needs to be treated right away as an urgent case. The other syndrome is the paraneoplastic syndrome. Some lung tumors may cause problems in distant tissues and organs rather than the cancer in its place. Those problems are called paraneoplastic syndrome. Paraneoplastic syndrome can affect your nervous system. We call it paraneoplastic neurologic syndrome, or your endocrine system, paraneoplastic endocrine syndrome. Sometimes these syndromes may be the first symptom of lung cancer, so everyone should be alert about these syndromes and the symptoms, because the symptoms of other organs, a disease other than lung cancer, may first be suspected as causing them. Paraneoplastic syndromes can happen with any lung cancer, but are more often associated with small cell lung cancer, SCLC. In paraneoplastic endocrine syndrome, the lung tumor makes hormone-like substances that enter the bloodstream and affect distant organs. Examples include syndrome of inappropriate antidiuretic hormone. There are many diseases that can cause syndrome of inappropriate ADH hormone. Cancer is one of them. In this condition, the cancer cells make the ADH hormone, the antidiuretic hormone, that causes the kidneys to keep too much water in the body. This lowers the salt level in bloodstream Symptoms of inappropriate ADH syndrome include fatigue, loss of appetite, muscle weakness or cramps, nausea, vomiting, restlessness, and confusion. Without treatment, severe cases may lead to seizure and coma. Cushing syndrome is one of the paraneoplastic syndromes as well. There are many reasons why a person may develop Cushing syndrome. Cancer is one of them and is called ectopic Cushing syndrome. In this condition, the cancer cells make ACTH, adrenocorticotropic hormone, a hormone that causes the adrenal glands to make cortisol. This can lead to symptoms that include weight gain, easy bruising, weakness, drowsiness, and fluid retention. Cushing syndrome can also cause high blood pressure, high blood sugar levels, or even diabetes. One of the paraneoplastic endocrine syndrome is the hypercalcemia. The tumor can make a hormone called parathyroid hormone related peptide, PTHrP, that acts on the bones and kidney to increase the level of calcium in the blood. High level of calcium in the blood, hypercalcemia, can cause frequent urination, thirst, constipation, nausea, vomiting, belly pain, weakness, fatigue, dizziness, and confusion. In paraneoplastic neurologic syndrome, the tumor can cause the body's immature system mistakenly attack parts of the nervous system, brain, spinal cord, nerves, rather than the cancer cells. Examples include Lambert-Eaton syndrome. In this syndrome, the tumor can cause the immune system to attack the neuromuscular junction, which is the place where nerves communicate with muscle. This can lead to muscle weakness and issues with walking, speaking, and swallowing. One of the first signs may be trouble getting up from a sitting position. Later, muscles around the shoulder may become weak. Paraneoplastic cerebellar degeneration. This disease can be caused many different cancers, include small cell lung cancer. The immune system makes antibodies meant to attack the tumor, but instead mistakenly attacks an area of brain called the cerebellum. This can lead to loss of balance and unsteadiness in arm and leg movement, trouble speaking, trouble swallowing, and changes in vision. Paraneoplastic limbic encephalitis. The limbic system is a part of the brain that is in charge of storing memory and controlling emotions and behavior, as well as blood pressure and heart rate. The tumor may cause the immune system to damage the limbic system. This can lead to memory loss, personality changes, mood changes, sleep issues, and seizures. Again, many of these symptoms are more likely to be caused by something other than lung cancer. Still, if you have any of these symptoms, problems, it's important to see your doctor right away so the cause can be found and treated if needed. So this is the summary of the symptoms of lung cancer. So it's better to be alert and to know all these symptoms and keep them in your mind. If you have that kind of symptoms, please do not delay seeing your doctor in order to get the first early diagnosis and to get the chance of being cured. And I'll continue to do the series of videos regarding lung cancer and all related issues. And please do not hesitate to contact us or email us upon you have some questions or concerns about yourself or your relatives and about your disease. Hope to see you in the next video. Take care. Bye.